Dr. Wilkins, when a woman reaches her 50s, what are some things she should do to make sure she stays healthy?
So, to ensure health at 50 and above, I would recommend eating a healthy diet, watching your portion sizes. Half of your plate should always be fruits and vegetables. A quarter of the plate should be grains, preferably brown, rice, pasta. Also, beans is a good option. And a quarter of the plate should also be meat, which is lean, no larger than 3 ounces, preferably baked or broiled. Fish is also another good option. So the less frying we can do and the healthier foods we can eat, always helps to improve our health. Exercising 30 minutes most days of the week is also another recommendation. Staying up to date on vaccinations, wellness screenings, and also remembering that interaction with others is also a key of aging healthy, because that helps to keep our memory sharp and helps us to avoid things like depression and social isolation.
Okay, how do women's appetites and metabolism change in their 50s?
Okay, so above the age of 50, metabolism starts to slow down, the heart rate is a little slower. So women over 50 actually need less calories, about 1900 kilocalories per day, to satisfy nutrition requirements. So as we age, we need to reduce our calorie intake.
Are there any other foods or vitamins that women in their 50s need versus what they might have needed when they were younger?
So above the age of 50, women need at least 1200 milligrams of calcium a day, which is equivalent to 3 to 4 servings. Calcium-rich foods include green leafy vegetables, lean meats. Vitamins are also recommended if one does not think they're getting 3 to 4 servings a day. 1200 milligrams of calcium and 600 milligrams of vitamin D. Other calcium-rich foods include milk, eggs, and cheese.
Are there any vaccinations or tests or screenings that women in their 50s should consider?
So women in their 50s should always obtain a yearly mammogram as well as routine pap smears. Pap smears are indicated every 3 years. Colonoscopies are also indicated above the age of 50 every 10 years. Vaccinations like shingles vaccine as well as the yearly vaccine are also recommended.
And a lot of things can happen to someone in their 50s. Kids move out of the house, elderly relatives pass away. How can women keep mentally resilient as well as physically healthy?
So like I mentioned earlier, to keep mentally resilient and physically healthy, exercise 30 minutes most days of the week is a recommendation. And exercise could be anything from swimming to jogging to taking a nice walk in the park. Also, keeping mentally alert by interacting with others is also helpful. Participating in family gatherings, having loved ones around, all those help to keep us mentally fit. Eating healthy also helps to improve our mental sharpness and all those good things that we do.
Do you have any other tips for anyone over the age of 50 that they might need to consider?
So over the age of 50, always remember to keep your yearly screening exams with your primary care physician. When you come to see me, I'll order all the tests you need and refer you for recommended screening tests that are needed for your age. Always keep vaccinations in mind. The yearly flu shot is very important as we get older. So all these help to enable you to gracefully age.